Dr. Nitu Bajekal, what an absolute joy to have you with me today on Meet the Vegans. Thank you so much for joining me.
Not at all. The pleasure really is mine. I have always enjoyed talking to you, and today's going to be just a lot of fun.
Every time I've ever met Dr. Nitu Bajekal, I have had a good time, I've had a good laugh, but I've always learnt something that's been of great value to either myself or other women in my life. And so I'm really happy that we can share some of those golden nuggets with people today. And also, I think it's really important to note, this is not just an episode for women. There's going to be a focus on women's health, but men, listen up. This is crucial information that you need to be aware of for all the relationships you have in your life with women. So don't tune out. Would you agree?
Absolutely. We have to remember that all of us know women, whether they are our mothers, sisters, partners, friends, and there's so much that I'm going to talk about that is not just relevant for women, but also for all genders and for men. So yes, please don't tune out.
It's very important, very, very important. So just to kick us off, in one sentence, why would someone want to meet Dr. Nitu Bajekal?
I would say that probably because I'm fun, I'm interesting, and I'm very passionate. So I think those are probably qualities that make somebody want to meet. And I'm interested in people. I'm interested in humans. So
Me too. The human story for me is where we can learn so much from each other, and listening to other people's stories and the richness of that, just gives me so much joy.
Absolutely. Even if I'm in a taxi in a foreign country, I'm just interested, even in sign language and with, talking to the cab driver, just fascinating. Everybody's lives, we have so much to learn from. So I am a great believer in the human connection and the human story.
Absolutely, me too. And how would your best friend describe you?
I would say very loyal, very dedicated, a bit crazy. Again, I think very passionate, and I care a lot. So I think I care for my friends, I care for my family, I care for people around me, I care for the planet. So I think my friends know I like change. I like to, influence. Keep things moving. I like to influence people through example. So yeah, that's what my friends and my best friends would say.
Fantastic. Now, all of my work as the founder of a vegan charity, and my work prior to that as a journalist was always motivated by a variety of things, but I kept coming back to three things: joy, compassion, and empathy. Those were the things that really guided my veganism, but also guided my work and my activism. Can you share with us, how do you extend your compassion to the world beyond not eating animals?
So if I think about that, I would say I use my career, my profession, which I fell into completely by chance. I didn't know I wasn't born thinking at the age of 3 or 4, like a lot, including my husband, they all knew they wanted to be doctors. My sister and brother were doctors. And I just did medicine in India because I thought, okay, I'm good in studies. I really wanted to be a sportswoman. I was good in sports, in athletics, but there was no future in that. So I became a doctor. And for me, I was so lucky. It was absolutely the right profession for me. And I use my profession to help guide people, because when you're vegan, you're doing this for the animals, but there is so much more to being compassionate, and that has to extend to people who are less fortunate than us, whether it's in health, whether it is in resources. And I have been blessed to have that knowledge that I'm so desperate to share with others. So I feel that's my main way that I actually share with
your compassion,
my compassion with others.
Mm-hmm. And then how highly dialed an empath are you? And how do you use that for action as opposed to letting it overwhelm you? Because I think when you're a very sensitive person, it can really overwhelm you. But how do you use that for action?
I would say I'm a highly dialed empath, which can make it rather hard. And it did sort of hold me back in the first few years when I got overwhelmed. I would look at people and think, why don't you see the world the way I see it? And get really almost paralyzed, when I would see things happening all over the world. And I really had to spend time doing some reflection, self-reflection and introspection, and realizing that what I can actually offer, I won't be doing any good if I just was angry all the time or upset all the time or feeling so much that I couldn't actually bring any change for people who really need it. So, yeah, I think there's still more work to do. I'm not perfect, but I think I have now realized that there's a lot to be hopeful for. And there's a lot I can give, because unless I'm happy, I found that I can't actually give.
Exactly. And I really had to learn that as a vegan activist with a charity.
Yeah.
If I wasn't happy, if I wasn't meeting my needs, I couldn't then do the work.
Yes.
And you shouldn't feel guilty about that.
No, I did. I did feel guilty for a long time. And I think I've been vegan for about 24 years. But the first few years were tough. And I think my daughters actually showed me the way, that there is a way of being true to your values, but at the same time, actually, enjoying life and not really just looking at everything with a very gloomy lens, because that really holds back progress.
I could not agree more. And then finally on that theme, how do you seek joy? And then how do you radiate joy out to the rest of the world?
I think I radiate joy through my face. I'm a great smiler and a laugher. But how do I radiate joy in other ways is really, again, sharing all that information with people. So I hope that, when people see me, they can feel that coming from me. Was that what you were looking for?
Yeah, absolutely. Yeah. And certainly joy is not something all doctors radiate.
No.
It's not a given.
No,
that's for sure.
Especially with our professions. But I am an obstetrician and gynecologist. And yes, there are sad things, but there's always hope in everything I find. And my job is to be confident and to pass that information along, at the same time not completely removing hope from anybody, because really the human body is such a marvel. Telling somebody that, I know best as a doctor is the worst thing we can do, to actually hinder that person's journey. So, yeah, I hope I do spread that bit of joy. And I get joy from walking my dogs, I have to say, and spending time with my family. Walking my dogs, and I have 2 rescue dogs, and I cannot tell you how much we love them and how much I love being with my friends and my family. I do enjoy that time. It's so important. But I love my work too, so I have no plans of retiring.
That's good to hear. I once asked a surgeon when I was a journalist, so when are you retiring? And he was so offended. He said, I haven't done this work all my whole life to dream about my retirement. And I was like, sorry about that. I mean, he was quite offended. Yeah, he was.
I just want to reinvent myself in different ways, which is what I'm doing. But I'm not ready to.
Yeah, you're not
hang
just going
up my coat
and book the cruise, and just.
I can do that too, but I don't want to. I love my job.
Can you tell us a little bit about your childhood in India and, what sort of circumstances were you living in? Was it usual for women to be super highly educated and go on to medicine? Was that unusual? Was it usual? Just tell us a little bit about your childhood.
Yeah, so I'm 63 years now. So I spent the first 29, 30 years in India. I was born in Calcutta, which is the capital of West Bengal, but I'm actually a South Indian by birth. My parents moved there from Mumbai, and my father was an engineer. My mother was initially a teacher and then became a deputy head teacher. She was a teacher of history and English. And so we were a very academic household. We had a very, very small flat because my father moved homes to be close to the best schools in Calcutta. So we lived in a tiny little flat with me sleeping actually on top of the dining table, and my brother slept under it. But we had 3,000 books around us. So I would just devour books all my childhood. And I had polio as a baby. It was just before the polio vaccine came in.
And that can be
And that is why I'm such a great proponent of vaccines, because I have seen the devastation that the lack of vaccine causes, kills thousands of children in India and all over the world. So I didn't get the vaccine, and I was very lucky to have it diagnosed, and I was not left paralyzed.
Which is so easily could
Which
have
is
been.
so easily. Well, most children would die from respiratory conditions, or be left paralyzed. And so my father was particularly, and my mother, but my father was particularly happy when I showed great promise in track and field athletics. So he really wanted me to pursue that as a career. But in India, that just wasn't the option. I actually didn't really think about myself as a girl growing up because my parents brought... I have an older sister and an older brother. Brother by 2.5 years. My sister is about 8 years older. And we didn't really realize there was a difference between my brother and us, although we did know that there was gender differences in society as general, but Bengal is a very matriarchal society anyway.
Okay.
And my father he had only brothers, so he was very much, he loved girls. And my mother was one of 4 sisters, so she was very pro-girls. So generally, we never felt anything. I was surrounded by highly achieving women. My grandmother was very well-read. My aunts were lecturers in physics and in maths and things like that. So all my professors were women in medical school. So,
wow.
So I was actually taken aback when I came to the UK and found that women actually had not that important role in the medical community. There were hardly any female role models for me, and certainly none that had families and things like that. So they had to almost become more masculine in their thing, because they were being beaten down, and all the men had 2.4 children and a 4x4 and a dog, while the women had none of that. And for me, that was quite a shock. I remember writing to my parents saying, boy, I have been in great shock to see this. But of course, don't get me wrong, India has got its own issues, a lot of it based on caste, similar to the class system. But if you're born, like I was born, in the right family, I was very fortunate to have that support of education and sports, grew up basically plant-based. My mother was a great empath and was very against, although by our religion, we were vegetarian, but my mother went one step further and became vegan as soon as she realized, what was involved. And so I would complain all the time as a child because my friends would have toast with butter and they would have cornflakes and milk, and I was given rotis with sabji and salad, or idlis, and I would get really upset, and my mother would say, well, look at who's the tallest in the class and look at who's the fastest.
She was right.
So don't come to me and tell me that you want to eat toast with butter, because you're not getting any of that.
Mom knew best.
Yes, and she had, she was holding down 4 jobs. She was a translator. She was really very busy as a woman, and my father was very good at helping around. As well. But
I think you were quite lucky to grow up in a family.
I was very fortunate. It's only when I reached medical school that I realized that, wow, there is a gender difference.
My mum is probably 23 years older than you. And, she was barely allowed to go to school, even though she was, born in the UK. She had to really fight to go to school because she was from a working class family.
Totally.
And lassies didn't go to school because they were going to stay home.
Yeah, and that's still, a lot of it is still there in India. So I'm probably, highlighting a very tiny segment, but that was my
experience. Your experience. So let's talk about women's health, your specialty subject.
Yes.
So what is the most surprising thing that women don't know about their bodies?
I have to say they do not know how this reproductive health system works. They don't know where their vagina is, they don't know where their cervix is, and they don't know where often their uterus is. They don't know how the hormones work, and that's not because women don't want to know. They are not taught in an easily accessible way in school. And there's a lot of stigma and shame associated around periods, around use of words like vulva and vagina. And really, it is not the role of the parents. It is a role of the government, my books, as well as schools. And, that's where education has to start. You can't expect parents to know everything or do everything. So I think we have to take a bigger role in that, educators.
And as a gynaecologist, what is some of your biggest frustrations in terms of the way women's health is addressed within the British healthcare system?
I think this is the world over. There's no difference. I think what is important to understand is there is a whole specialty, obstetrics, gynecology, so you can imagine how much research is there. But in some of the very basic situations of understanding periods, explaining that to somebody, there is a lot of dismissing of signs and symptoms and minimizing what women go through, because women have always been second-class citizens. They always have had to shrink themselves. You can't be too pretty, you can't be too ugly, you can't be too fat, you can't be too thin, you can't be too educated, you can't be dumb. All that. You think about it, and it's the same when it comes to medicine. It's this patronizing way, the patriarchal way that the doctor knows best. And while, of course, I have 40 years of experience, I am not my patient. My patient's got that inner gut feeling, that instinct when they know when you're saying something, whether it sounds right, whether it feels right. And your job is to reassure rather than frighten. Your job is to make sure that you explain things in an understandable way. And I think doctors hide behind a lot of jargon, and women's health is no different. So as a result, you come away feeling exposed, not respected, not taken seriously, told that it's all in your head. Hysteria comes from which is the uterus. Yes,
hysteria.
Yes.
It gets me.
Yes,
that gets me, and it's the reason why I completely disassociated from anything to do with hormone health, because I was born in 81. So grew up in the 80s and 90s, and hysterical women, hormonal hysterical women. So that had nothing to do with me.
No.
So I didn't learn about hormone health because I didn't have hormones, because I didn't have that condition. And consequently, that put me in deep trouble later in life when I had a really horrific perimenopause experience, which we'll talk about later. But that word, that phrasing, that the hysterical woman.
Yeah, women would be strung upside down, all kinds. When you think about it, nobody likes smart women, first of all. Even now, you know that from just watching around what's happening in politics and things like that. And it's very easy to be dismissed, to be overreacting, to be, overplaying your symptoms, and that No, women play into that as well because of the fact that we've been told by society you have to learn to suck it up. So It's not surprising for mothers and grandmothers to say, oh, but I had that. So, come on.
Trudge on. Keep going on.
You can do it.
Yes.
Come on, keep making the dinner for your husband while, he puts up his feet and watches television. No. Things have to change. And so I think in women's health as well, there is a lot. And it has improved hugely because I think a newer generation of women have come in, a lot of women in the field, and not that all women are empathetic, but I think there is definitely reason to start believing that changes
Things are happening. There's a shift. There's a shift. And is there a fundamental lack of research in women's health?
No, I think there's plenty of research. Mm-hmm. It's often not translated back to the public properly.
Right.
Because as I said, there's a whole speciality. Men don't have that full speciality. We have a whole speciality, obstetrics, gynecology. In that, there are so many subspecialties. When I'm doing keyhole surgery, I'm not specializing in fertility, and the fertility specialist is not specializing in maternal medicine or in cancer surgery. So there is so much research available, but it's often not targeted. It's often not translated back into real terms. And as I said, often people are not included in that research. So what happens is you may be used as guinea pigs, like we know about the cervical precancer cells, where women from the indigenous tribes of New Zealand were allowed to progress to full-blown cancer. And, yes, absolutely. So, historically, people have done this, as a result of which there's so much of mistrust, both in ethnic communities as well as in women, because they're not small men. And so research is often done.
Not small men.
Yes.
I like that.
Yes, because a lot of research is often done in men for things like cardiac and joints and bone and all that, and then extrapolated to women. That's where research is lacking.
Right.
Yeah.
So, yes, I was listening to some information about that. The research, the tests, the studies are done on men.
Correct.
And then because women are, the female results are anomalies, they get discounted.
Correct.
Outrageous.
Yes, it is.
Wild.
Exactly. I mean, we don't have time, but I talk about I have a whole chapter in my book in menopause. About
Finding
all
Me
the
in Menopause, fantastic book. One of the things that guided me when I was in a very dark place.
Yeah.
So do check out this book.
Because of the discrepancies in offering of treatment and things, depending on which part of the world you're from and whether you're working class or not and all that. So we do know those. So that's where research is lacking.
Right.
But in women's health, there is plenty of research not done very well to educate the people about the results.
So this segues nicely onto talking about speculums.
Oh.
So for anyone because when you mentioned the historical context, speculum is the device that is used to, I mean, you will explain it better than me. Why do you explain it?
Yes.
Why am I explaining it?
No.
You explain it.
So speculums are basically two types. There are more, but the two common types. One, which is called a self-retaining one. So you can actually use it to introduce it into the vagina. The vagina is a tube-shaped organ. And when you open it, you should be able to see the cervix. You can take a swab. You can take a smear test. You can look at the vagina. You can look at the cervix. You can take biopsies. You can enter into the uterus. That is known as a self-retaining speculum. But the problem used to be that there was usually only one size. And even now, I always ask my patient, what sizes have you been offered? And they say, oh, nobody's ever told us that.
I've never been offered a size.
Yes.
Ever.
So you can imagine that if you're menopausal and you're quite dry down below, or you should be offered a tiny little speculum. If you're somebody who has never had a baby vaginally, or if you would want to have something, or if you have like vaginismus, or if you're apprehensive, then a smaller speculum would be used. And then you have the regular size speculum. So if you've had vaginal deliveries or you don't have any concerns, and you shouldn't be introducing any speculum into any woman who's never had penetrative vaginal intercourse.
And I've never been asked that.
So, yeah, exactly. So it is so important
that I have.
Exactly.
I mean, maybe they can see my notes. I've had a baby, but when I was younger, I was never.
Yes, and it's so, so important to ask, because recently I was contacted by one of the newspapers, and a woman was very upset because she'd never ever had penetrative intercourse, and the sonographer said, I'm not going to do an internal scan for you. And she thought that was wrong, but actually that lady was doing the right thing, because that can be almost like assault, because you haven't actually, it's a whole different scenario.
Yes.
So speculums can be self-retaining, where you use it so that both the health practitioners' hands are free to do whatever they need to. But a lot of women have a lot of concerns about having anything introduced. So you do have to, I always tell women that do let the person know, the doctor or the nurse know that you've had a bad experience, or you're not used to it, or you need a few minutes and you are willing to wait, you would like to have some music, or you would like to have somebody in the room. It's so important. Then you have the other ones that we use during surgery called sim speculum. Both of them have been named by the men who've discovered them.
What a joy. We get to insert that into our vagina.
Correct. And they,
named after the male inventor.
Yes. And they tend to be either metal or plastic. And usually, like when we use the metal speculum, because there are some advantages, when we do use the metal ones, I would always make sure that they're warmed, so that it's not like a cold shock.
Yes.
And little things like that. And so I often talk about how taking deep breaths, doing some mindful breathing, telling people, making sure that you have done all the bits that you can, because examinations sometimes and it's one of the main reasons why women don't go back to doctors is because they've had a bad experience.
And delay the smear test.
Yeah.
Everyone delays the smear test. You get that letter in the post and you're like,
not sure.
Oh. Yeah, and even once in my GP surgery, the nurse went, 4:30 and they're sending me a smear test. She didn't even want to see me.
Exactly.
And that made me feel terrible. It's like, you don't even want to do
No, I'm sorry, I'm paying you.
Like,
my taxes are paying you. You better do it. But the good things are there's a very good research trial happening now, because a lot of women don't come for smears. So self-testing, is that going to work? As well as self-testing of infections for swabs, which is already available. So we have got things. But there are some times when you do need the speculum. But it's all about how you explain to people and say, you are in charge. I will stop anytime you tell me to stop. Those sort of things with the loss of control for women, especially, can be very difficult. Lying in that position. So I used to always make my trainees lie down on the couch and then talk down to them. And if you ever try it, you will realize, because you're lying on that stretcher,
feel very vulnerable.
You feel so vulnerable. So it's a good little tip for making my trainees feel a bit more empathetic.
Absolutely. And can you insert it yourself? Can you request that?
Of course, you can request it. But generally speaking, women find it hard when women already have this thing. But yes, of course, partners can insert it. You can insert it. You can take your time and do all the things that we recommend. But generally speaking, I would say that doesn't happen very often. Most women would rather the doctor did it, but did it kindly.
And on a similar note, can you always ask for a female practitioner? Because when I was pregnant, I felt extremely vulnerable around men. And I never had done before. I'd had examinations with men, fine. But when I was pregnant, I did not want another man anywhere near me.
You can always...
When I asked for this, there was an eye roll.
Yeah.
There was definitely an eye roll.
Now no longer.
Right.
Women are definitely allowed to ask, and we make the best attempt. But you have to remember that, at the end of the day, what you really need is an empathetic doctor. Just because you're a woman doesn't mean that you have all your
empathy
there.
Yes.
I think, but certainly we always ask, and there's provision even for sonography, whether it is for delivery, or even in the operating theatre, some people will want only a female staff. And it's not always possible, but we do try and accommodate as far as possible. But sometimes, night duties and things.
Yes, it's not realistic. Let's talk about perimenopause and menopause. So we've already mentioned your book, Finding Me in Menopause. This is a fantastic book.
Thank you.
Such a vital resource.
Yeah.
Really easy read, really joyful to read, as well as covering some of the nitty-gritty. You had your own quite early menopause experience when you were 38.
I was 38, and I thought, being a typical doctor, I buried my head in the sand, and I used to always have regular periods. I had no issues, but when I started missing periods and having terrible hot flushes and anxiety and things, I thought it was part of being, I was applying for a consultant job, which is very stressful, very few numbers. And, you want to be the best. You're already an immigrant. You're a woman. You're a woman of color. So there's a lot stacked against you. But
no room for you to have a health issue.
No.
Yeah.
So for me, I was wanting the best job. I was, competing with men. I thought I was also being bullied. So I didn't really put it down to perimenopause and then menopause, but it was quite hard. And it was also the time when HRT got very bad press because of media misrepresentation. So doctors, GPs weren't happy to prescribe, which I should have. I should have been 200% on HRT, but I wasn't bold enough to go and talk to my male colleagues who in retrospect would have been very supportive of me. But at that time, I wanted to be the top of the game, the best surgeon, the best everything. I didn't want them to see me as vulnerable.
And we almost back then weren't allowed to be female. Like success was almost associated with a male way of behaving.
It was, but I wouldn't say that was what stopped me. I just knew I'm a very goal-oriented person. And I just knew, because I was somebody who went back to work within a few days of having my children, just all that.
But HRT would have helped you so much.
So much.
Hindsight.
Yeah, but I went many times to my doctor and they said absolutely not, because they didn't understand. And that time, all the women were stopped from taking HRT. So I couldn't self-prescribe and I only had male colleagues. So I missed out big time, but I'm still here at 63, so that's okay.
We will come back to talking a little bit about that misinformation around HRT. But for now, can you, because 2 years ago, I had never heard the phrase perimenopause. I'd never heard it. Now I feel like it's everywhere.
Yeah.
I feel like my phone listens to me and spits up adverts and books and everything. But can you tell us, what does perimenopause mean and how does it differ to menopause?
So perimenopause is around menopause. Peri basically means perimeter, around menopause. So it's the time leading up to menopause and actually includes the year before you're labeled menopausal. So, and tends to be around the age of 47 for a lot of women, but the average age of menopause. So it's better to describe what menopause is. Menopause is when your periods completely stop. You're born with a number of eggs already. So you have the maximum number, a couple of million eggs in both your ovaries at 20 weeks of gestation when you're inside the uterus. By the time you're born, half of those are gone. So you have about 1 million. And then over time, puberty, and then in your 20s, 30s, 40s, the number of eggs you lose thousands every month. Okay, the pill doesn't stop you from losing it. Pregnancy doesn't stop you from losing them. You lose a lot of eggs. Only one of them is selected every month if you ovulate. And then when those hundreds of thousands of eggs drop to less than 1,000 in your ovaries, that's when periods stop. So that could be like me at 38. It could be at the age of 12. It could in 1 in 10,000 women. It could be 1 in 100 under the age of 40. In fact, we now think it's about 4 or 5 in 100. It could be 1 in 12. 12 in 100 women under the age of 45, but the average age of menopause tends to be between 45 and 55. So women will stop their periods completely, and after 1 year of not having had any periods, you're then labeled as menopausal, and you will stay menopausal or postmenopausal for the rest of your life. People say, oh, I've already been through menopause. No, you're just talking...
like it's finished.
No,
like
it never finishes.
Yes.
So we now live till 83, 84 in this country. So from, say, if you were 51, which is the average age of menopause all around the world, you would live another 3 decades in the menopausal phase or postmenopausal phase. So 45 to 55 is when women become menopausal. That's the range. If it's earlier than 40, it's known as premature ovarian insufficiency. Between 40 and 45, it's known as early menopause. But perimenopause tends to occur anywhere from 2 to 10 years before you stop your period.
And that was such a newsflash to me. I had no idea that 2 to 10 years before that, I needed to look out for these symptoms.
Correct.
Had no clue about this. And most of the women I spoke to had no clue either. So I thought I was going mad.
Yes.
I thought my whole body had collapsed and given up on me after it doing such great service up until then.
Correct.
It was bewildering.
And so we know that women, say from India, different parts of India have different ages of when they stop periods, but 45, 46, 47 is when often many Indians and African women from the African community would stop their periods. Japanese women would have a late menopause. So we know that. And then the average age of perimenopause is about 47. So if you're stopping your periods around 51, about 4 years before that is, but we know that that's the range of 45 to 55. So if it is 2 years or 10 years before, you could be just 35 when you start having hot flashes or mood swings or lowered libido or bone loss changes, and you've not even started trying for a pregnancy. And remember, those eggs that are needed, they are dropping, and your anti-Mullerian hormone, a blood test that actually predicts menopause, which is still in the research phase, but we know we use it for infertility, but we also know it's useful for perimenopause and menopause. That AMH levels start dropping. So women at 35, 37 may be in the perimenopause, and they've just started thinking about egg freezing, or they've just met somebody and they're going to start a family, and it may not happen.
And that is something that's just not commonly shared.
Correct.
And now I know what I know. I was perimenopausal from 37.
Correct.
And I'm still perimenopausal. I haven't gone through menopause yet. But my horrific symptoms were 2 years ago when I was 41.
Yeah.
And they came straight after influenza. So I had a very bad flu infection, which I now know
upset your immune system.
Can be a pathway. But alas, no one else seemed to know. Like there was my symptoms were textbook: insomnia, racing heartbeat, anxiety, fear, textbook. But no one had read the textbook.
No. But also, I think it's important for doctors to not label everything perimenopause and menopause. It's really important to be a detective, because that's what medicine is about. You have to listen. You have to take a good history. You have to look at the clinical signs and then work out, because the thing about perimenopause and menopause is that it's after you've excluded other things. What you don't want to do is miss out on real depression or anxiety and things which will actually need medication. But at the same time, perimenopause and menopause is not going to be managed really with an antidepressant
or a sleeping tablet.
Or a sleeping tablet.
Quite.
You do need to consider diet, lifestyle, and HRT as a trial. You don't have to take it forever. If you feel it's not helped you, then you can always come off it. But it's so important to have that, have to have a broad look at things rather than, it's so easy, if you're a menopause specialist, everything is menopause. If you're somebody who is a psychiatrist, everything will be depression. So for the woman to navigate the system can be so hard, especially because we do talk a lot about menopause now, and that's so great, but we shouldn't lose the wood for the trees or the trees for the wood or whatever, whichever way you look at it. It's so important that I want people to realize that you want a clinician who actually takes your symptoms and discusses them with you and make sure that they haven't missed, a rip-roaring infection or diabetes or something else is actually causing your symptoms.
Something else. What made me so upset and sad about all this, and I will get quite upset when I talk about it, is when I saw when the peak suicide rate was for women. And it's when we're about 47.
Correct, 45 too.
And I don't think that's a coincidence.
No, not at all.
And I didn't sleep well. And when I say well, I barely slept for 4 months. And that will push you to the brink of your sanity. And the doctor on the phone would say, "Oh, do you have suicidal tendencies?" And you're thinking, if you hadn't slept for 4 months, how would you be feeling? But because I have a child and you're so terrified the child might be taken off you, you go, no.
Don't have anything.
No. But if you're not sleeping...
Yeah. I mean,
it drove you mad. It nearly drove me mad. And then when I saw those statistics about suicide, it really just cut me, because how many women do we lose when actually they might just need HRT?
Yes, it is very, very difficult. And I can share with you that sleep is, of the 6 lifestyle pillars, sleep is where I fall down hugely, because my profession basically meant I was awake every third night, and then bring in menopause at 38. I don't think, every now and again, I'll get a really good night's sleep. And I'll think, wow, this is what normal people feel like. Because I don't think I sleep more than 4 hours.
Wow.
And now I try and prioritize sleep, but 30 years of not really sleeping very well has huge impacts on everything from cancer rates to dementia to, cortisol levels, making perimenopause worse, menopause worse. So it's so important to actually prioritize sleep. Really, really important.
But by the same token, what used to drive me mad, I was lying in bed, I was ready to sleep and I couldn't sleep. Yeah. And people would say, "You must get your sleep." And I'd be like, "I'm trying."
And the more you try, the
worse it gets.
So that's why having sleep hygiene I don't love that word, but actually having certain ways that work for you is so important, because you have to find some way of working through it. Taking a sleeping tablet is okay, but it's not something that should be the first go-to at all. There's so much one can do, and I know that from personal experience. I don't follow it all the time, though.
And what changed everything for me was knowing what it was finally.
Yeah. Getting a diagnosis.
Which I diagnosed myself.
Yes. Most women do.
The fear just left my body. I still, had the symptoms, but just
knowing.
I know what this is. And so I took up weight training.
Totally.
Because I wasn't sleeping much. Well, the doctor said, don't exercise. That was the worst advice possible. So I'd stopped exercising. So I was like, so I started exercising.
Give him my book.
Again. I do need to give him a book. I started running. I started weight training. And then guess what? I started sleeping.
Yeah, swimming. Great thing.
I started sleeping again.
Yeah,
and so it was only after a few months of all the lifestyle changes, I thought, do you know what? I'm going to take the HRT because my estrogen was so low. I think it's beneficial. So can you just explain to people, what is HRT? What does it stand for? What are we looking for these days? What's good quality delivery? What's not so good quality?
So HRT, or hormone therapy or hormone replacement therapy, is basically a combination of different hormones. The one hormone that you need is estrogen. Estrogen is present in every tissue in our body, including our brains, which is why the brain fog and all that. So we know that estrogen levels will keep rising and will be in the reproductive age group. We will have certain levels. Women tend to have 4 times more testosterone than estrogen in their reproductive age group, and nobody realizes that. They think testosterone is a male hormone. It isn't. And so what happens once the periods stop, remember that the eggs are dropping to below 1,000. The eggs are what are producing the estrogen. Most of the estrogen is produced by your eggs. And so when those estrogen levels drop to a level where you start then having things like hot flashes and night sweats and things. So without estrogen, there is no HRT. You have to have estrogen as the cornerstone of hormone replacement. Almost all women who need HRT will improve within a month to 2 months of starting medication. Now, you may have heard of progesterone. So progesterone is only needed if you have a uterus. It is not HRT. It is part of protecting the womb, the lining of the womb, from cancer if you give unopposed estrogen. If you only give estrogen to somebody with a uterus, you can increase the risks of cancer on the uterus. Right. So that's why you bring progesterone in. And you don't want to have progesterone with all these creams and things like that. You have to have it in the form of the way the body naturally produces it. So a micronized progesterone, which is a tablet form.
It's kind of a soft tablet.
Yes.
When I hold it in my fingers,
correct,
it's a bit squidgy.
Yes. Yeah. And it can help with sleep. You can use other forms of estrogen, of progesterone. We don't really recommend vaginal pessaries because we don't have studies to show that it gives the same protection. Progesterone can also come in the form of a coil, and you can use it for 4 years, and that can help with women who are having irregular periods, which means periods too often, very frequent periods, heavy periods, conditions like endometriosis or adenomyosis, which can make HRT harder to settle in. So the Mirena coil can be very useful. The estrogen can come in the form of tablets and patches as well, and gels and things like that. So there's so many different ways, but all of them try to mimic as much as possible. We don't use, the horse's urine and things anymore. So
that's the old type.
So we know, and the doses were much higher. Right. We know that these forms, which are known as body identical hormones. So we strongly recommend women not to go for the custom compounded bioidentical hormones, which would be like you would come and see me and I would give you Dr. Bajekal's HRT, because it would be like me sitting in this room and compounding it. So one day you'll get high doses of estrogen, next day you'll get very low doses, completely unstandardized, non-standardized, dangerous for you actually, and a waste of money. Because there's a lot of people who think natural is good, but natural is what HRT is, that is recommended by experts and by the British Menopause Society and by the Royal College of Obs and Gynae in US, Australia and things.
Is it true that it comes from yams?
So they tend to be plant-based generally, but the progesterone creams that come from yam and all are not really what we recommend. But all HRT, all medications, if you think about it. That's why one has to understand the beauty and the glory of allopathic medicine. Nothing you can use hasn't gone through rigorous testing. Most medications are thrown by the wayside because they can't do their job. So that's why, yes, they are plant-based, the patch, for example, and things like that, and many of the tablets are, but it has to go through very rigorous testing. If it wasn't, it would be called, Ayurvedic treatment or homeopathic treatment, because there's no comebacks. Nobody is held responsible, while with allopathic medicine, it is. That's why we know what side effects you can have, and that's why we need to know. Now, there's a third hormone. So estrogen is used to help you rid your symptoms, protect your bones, help your heart, help your brain. The best time to start HRT is around perimenopause, and under the age of 60. After 60, we don't have the studies, but if you are on it and you want to continue on it, then that's a discussion that you have with somebody like me.
Does it protect against potential like osteoporosis?
It's 100% protection for osteoporosis. But we also know there are benefits for the heart and for the brain and overall general health. So a lot of women, if you're not contraindicated, should take HRT, but often people start it when it's not yet indicated, or it is they haven't been explained the possible side effects. So they start having breast tenderness or some headaches initially, or they have bleeding and they give it up because they've not been told. So for every 10 women, only one will actually stick with HRT and not continue with it. So it's so important to start it at the right time, have the right knowledge, empower oneself, but also have the clinician explain it properly. And testosterone is something that is very popular nowadays, but in my experience, most women don't need it. The ones who do need it, most of them don't continue taking it. But if you are going to take testosterone, you have to remember it's off license still in the UK because we don't have the big trials. And so it has to be done again under specialist guidance. So HRT is very useful, but on its own, I don't think it's not a pat. It's not like a Band-Aid.
A silver bullet.
Yes, not a silver bullet. You still have to do diet and lifestyle, which will hold your hand from birth to death.
And that made a huge difference to me, changing the supplements I was taking, changing my exercise regime, changing the food I eat. Alas, I've had to give up deep fried food because it's a hormone trigger.
You don't have to give up anything, but you have to know that if you are eating very highly sugary foods or you're having deep fried foods, your hot flashes might get worse. So again, I discuss all this in the book, but I also want people to enjoy life. And so if that's something that you want to do on occasion, do it. But then if you find that you're paying the price, then don't do it.
Exactly. And I know I do. If I'm going to have a treat, it has to be before 1 p.m.
Yes.
As all hell.
Yeah, it's like if I drink coffee, I know. That's it. If I have coffee after 11 o'clock in the morning, I'm not sleeping that night.
Game over, yeah. So why are people so scared still of HRT? And why is it when you mention it to people, other women, they go, oh, but it's better to do it without. It's better to do it naturally. Or that's bad stuff, that is. It's not good for you. That gives you cancer. There's so much negativity surrounding it still. Why is that?
This is because of the two big studies in the early 2000s, late 1990s, the WHI study and the Million Women study, which was looking at seeing whether women were protected against osteoporosis. And so they basically recruited women in their late 60s, 70s, where already they had a focus of breast cancer, because 1 in 7 of us will get breast cancer. And so what then happened is they found there was increased diagnosis, and so they said, oh, that's because of HRT, stop the trials. And so the media got hold of that information, and before the clinicians could actually distill and explain, it was too late. And that legacy has been left now for 20 years, depriving thousands and millions of women from treatment that could actually, save their relationships, save their lives, save their mental health and all that. It's not for everybody. Not everybody wants to take HRT, and that's fine. But it should be an informed decision. It should not be the decision of your doctor or society. You have to decide. And so that's why my book is about diet, lifestyle, and HRT for those who want to take it. But some women can't. If you have a clotting issue, if you've got a history of cancer, then your oncologist may not be happy for you to take it. So there are some certain caveats. But I think it's so important not to be scared of it, because the risks regarding cancer or clots and things are so minuscule that just by carrying excess weight, you increase your risk by 8%. Just by smoking or even having 2 or 3 small glasses of alcohol in a week increases your breast cancer risk, for example, significantly higher in the menopause. So there is no safe limit of alcohol or tobacco smoking. So it's important to understand that carrying excess weight, huge risk, because you're increasing the amount of estrogen in your body, which is not available to help your hot flashes, but is actually increasing your risk of worsening your endometriosis or worsening your breast cancer risk or ovarian cancer and all the other 7 different cancers. So that's why it's had such a bad press. And I think now more and more we are convincing people about the benefits. But yes, if you take it very long term, there may be an ever so slight increased risk, but so negligible that it's something that you need to discuss with your doctor if you're worried about your family history or something. But it's really not something that women should deny themselves because they are scared. I would strongly urge them to go on to the British Menopause Society, read my book, go to the Royal College, anywhere where they can get the science. Science is so important, because people make these throwaway remarks about the pill, about HRT, and they save lives. It may not be for you, and that's fine. But you cannot take N of 1 and actually say that it's a bad thing, because a pregnancy is much more dangerous, for example, than the combined contraceptive pill. So one has to remember that. But yes, if it is causing you, mood changes and things, and you are in a stable relationship where if you got pregnant, it's not the end of the world, where it is the end of the world for many people in their lives. So it's just actually just being sensible and not putting an influencer on the same platform as, say, my 40 years of experience. I think it's important to understand that. It's not my opinion, it's scientific facts. Look for facts. It's not, I think people should do it. That's not good enough. I only want to talk about science.
And when you think about how it could change women's lives, though, who are really suffering in the way that I was, and I don't think people, I couldn't go to work. I couldn't look after my child.
You're paralyzed, basically.
Lost all sense of who I was for 4 to 6 months. And to build that back up again was a huge journey.
Yes.
And
knock on your confidence.
The fact that I could have been offered HRT within 3 weeks, or
you would need somebody very, very switched on for that. 4 to 6 months at the end of the day is, in the real world, is... You advocated for yourself very well, I would say there.
In the end. But I wasted so much money on holistic treatment.
Yeah, I agree.
I went to see all sorts of people. They all said it was this, that and the other. I spent thousands.
I know.
And I couldn't work.
No.
And in that time, other people, you can lose your job, you can lose your house.
Totally.
You can lose your
and
relationship.
people may not have the finances as well.
Exactly.
It can be very, very upsetting. And that's why you see people taking years to be diagnosed, years and years. So, yeah, if you're lucky and you can get the right clinician at the right time, that's why women have to educate themselves, empower themselves, because it's hard. Doctors know a little about a lot of things when they are GPs, and a specialist like myself will know a lot about few things. So can you imagine? The woman is stuck in the middle.
No, absolutely. And then... just one more thing. Can we talk a little bit about vaginal estrogen? Because this could be extremely helpful, again, to many women. Tell us a little bit about that.
So the vagina, one of the symptoms of menopause, there are about 34 different symptoms. One of them is known as the genitourinary syndrome of menopause. Tends to occur around years 6, 7. It can occur earlier, but from the time you stop your periods, around 5, 6 years, you peak the lowest amounts of estrogen. What happens is the amount of estrogen in the vaginal tissues and in the bladder tissues drops, and so the skin becomes very thin. It tends to crack, especially on intercourse. The bladder gets very sensitive, and you keep getting treated with antibiotics for infections when actually you have cystitis because the bladder is all red and inflamed and is thinned out. And so adding some estrogen helps to make this tissues more supple, again, the vagina as well as the bladder. So it can be a game changer for people who are struggling with just feeling so down below. So always, I have a whole fact sheet on my website telling people the importance of using natural oils. So things like coconut oil and vitamin E oil on the outside, using vaginal estrogen, vaginal moisturizers, avoiding soaps, perfume, toiletries, all the things that we use, without even thinking about it, harsh laundry detergents, all these things dry out the skin. So you want to do all the general vulval care measures, not overwash with all the soaps and things, and add in the vaginal estrogen. Women who are on the systemic HRT, like you said you were, where you're taking the gel or the patch or the tablet or whatever, often they won't need vaginal estrogen, but some women do, and you can use it side by side. Even women with breast cancer, most of them, of my patients, will be on vaginal estrogen, which at least allows them to feel more comfortable. Intercourse is not painful, along with lots of different things that we can do. There's so much help available, but vaginal estrogen is very simple, and you can use it until you're 120. So
if we're lucky to make it there. Fantastic. Fantastic. The menopause. I know your expertise is women's health.
Yeah.
But I've noticed many of my my sensitive male friends in particular, once they're in their 40s, mid-40s onwards, they're more emotional, they're suffering more, there's more mood swings.
Yeah.
There's a change that's going on. And I see it in my husband. There is a menopause
There
happening.
is, which has not been researched very much, but you can imagine testosterone levels start dropping, and testosterone is a very important hormone for men and women to boost the brain and to boost the hormone, the general feeling of well-being. And so as you get older, the testosterone levels drop, which is important to be aware of. Does it mean that you replace everybody? No, but it's just important that just acknowledging these things help. Men have estrogen just like women have testosterone. Those levels drop as well. So is it a surprise that men will have something called menopause? No. Has it been researched? No.
And again, if you look at the suicide rate in men,
it's around the 45s. Yes, finance plays a big role because financial difficulties tend to have that. But that tends to be, again, to do with the fact that, they're probably struggling with their hormones and their health.
Managing at work.
And we used to have very high levels of suicide in women, and we've turned that around in this country. But the vast majority of suicides tend to be in men because, again, not talking. Age range and not talking about it. Once people acknowledge these things, once you're acknowledged that you have a thing, life becomes so much easier. When you're trying to live a double life and pretend everything is okay, it's very hard.
It's impossible putting a mask on.
Yeah, but that's what most people do because society demands it. And actually, we have to break those taboos, talking about every single thing without any guilt or any shame. Because if somebody's judging you, don't be their friend.
And I think, men really need this conversation to
totally
fire up because they don't have the language for it and the support networks and anything, really. It's almost met with ridicule. You say the word menopause, everyone goes, tee-hee-hee, and you're like, well, actually, it's the thing. It's real. Even the NHS has a page now on the website.
I'm not surprised.
Yeah, it's not called the menopause. But I think that's a great name for it.
Yeah.
Let's talk a little bit about your book, Living PCOS 3. So you actually appeared on ITV this morning talking about this, and that created headlines. And you said it was the most watched interview of 2024. Tell us about that interview and tell us about what PCOS is.
So polycystic ovary syndrome is an endocrine condition. It's very common, just like endometriosis is. 1 in 10 women are supposed to have the condition, but we think it might be as much as 3 to 4 in 10. And then if you bring in situations where women are struggling with, say, weight or acne or insulin resistance or fertility, then the incidence goes up even higher. It's a condition very similar to type 2 diabetes. So everybody can understand what type 2 diabetes is. It's not a disease of the ovaries. There's nothing wrong with your ovaries. It's just the messaging
confusing.
from... Yes.
Called that.
Yes, it's a terrible name. It's actually a metabolic syndrome. So it's like diabetes. And that's why we know that we believe that there could be a genetic issue, like a chromosomal break, and that's what's causing it. Tends to occur when you're actually, just like endometriosis, which can coexist, occurs often when you're in your mother's stomach, in the uterus, and it's often not. We don't like giving a formal diagnosis until you're in your 20s. But irregular periods, hormonal changes, which basically result in increased levels of androgens or testosterone, much more than what you would expect, so that you have cystic acne along your jaw, adult acne, irregular periods, excess hair where you don't want it, loss of hair. So these and all the signs of insulin resistance, so harder to lose weight, but other symptoms that nobody talks about: anxiety, OCD, having more increased risk of suicide, pelvic dysfunction, infertility, and often doctors will say, "Come back to us when you want to get pregnant." There are so many other symptoms. I know.
Just go away.
Go away.
Suck it up again.
Suck it up.
We're
again.
back to
suck it up again. So this was a book that I wrote during COVID, along with my daughter Rohini, who also has the condition. But I was planning to write a general book. And so she sat me down and said, "Mom, you're a specialist with 35 years of experience. Are you going to really write 2 pages on each women's health condition rather than doing deep dives? I think you should write something that nobody talks about. There are hardly any good books." And it was meant to be a slimline book. It's a big fat book. But the good thing about both my books is you don't have to read every chapter. You can just pick and choose the chapters. Hair loss, you can read that chapter. Excess hair growth, you can read. Weight gain, you can read. Protein intake. You can choose, because not everybody wants to read the science bits of it. Not everybody wants to read about HRT. Not everybody wants to read about fertility. Mm-hmm. So it's important to understand that. And for those who don't like reading, they can go on to podcasts like this, or onto my website, where I have 50 different fact sheets, all free and little ones, so they can read quickly, and learn from it.
Having talked about everything we have to do with women's health, do you think we need a women's health revolution?
I think it's already happening. More than women's health revolution, I think just taking the matter in your own hands. Advocating for yourself. Do not just think somebody sitting opposite you, just because they've got degrees and things, always know what's best for you. You have to go and make sure that you do the work yourself, so you're prepared. And so that's why I have a chapter in the book where I say, what are the questions you want to ask? What are the top 3 things that you want to leave the room with? You go there, 10 minutes, you've forgotten when your last period was, you don't know what your cycle is. You think the doctor's going to take you seriously? No. You don't have to feel bad for the patient coming afterwards. You have to think, I have to advocate for myself. I have to make sure that I am listened to. That's really important. Mm-hmm. And if you don't do your homework, the doctor doesn't take you seriously and will give all their time to that other person who comes along, who's got pages of all the information with them.
So is it time to sort of really proactively manage our own health and
totally.
not just look towards doctor as God?
No. I'll give you my own story.
Yeah.
I'm from a very healthy family, but there's a strong family history of heart disease from very familial high cholesterol levels from my mother's side. I had 2 uncles that dropped dead at 45. My brother had a heart attack at 45. And so I was very worried, because when my cholesterol levels, when I checked them, they were really high. And they went even higher when I became menopausal. So high that people should have been really scared. And then I went vegan and my levels dropped to just still not the NHS acceptable levels. And I knew I needed a statin. I went to 3 different cardiologists, including a plant-based cardiologist, including a woman, including a cardiologist in India and cardiologists here. And it took my daughter, Rohini, who's a nutritionist, and me to really have to advocate for myself and get people to listen. And, I probably, more than the HRT, I probably cut my life short by not being on a statin for all those years. And I'm so happy that, I finally got heard. So really, just because I was a doctor, and people will look at me and say, "Oh, you're slim, you're vegan, you've no health issues. You don't need to worry. You're not going to drop dead of a heart attack." I knew different. I'd done the research.
Just prioritizing your health and taking control.
And sometimes having a second or third opinion, even on the NHS. You can ask to see somebody else. You have to be heard. And yes, sometimes, I will turn around and say, I know you're asking me for HRT, but this is not right for you. This is what is right for you. And if you don't trust that I'm coming from the right place, you have to go and look for somebody else. But you have to find somebody who actually listens to you and gives you the right information, not just what you want to hear.
Well, quite, yes. Not what you want to hear. Absolutely. And then just finally on the health theme, what are the 3 things women can do to get ready for perimenopause and menopause in advance? Because I had no prep.
Yeah.
No information.
Yeah.
And I feel like I should have been taught about this in school, along with this is your periods, this is when you get shown the video of a baby being born and all of that. This whole chapter was missing.
Complete.
So what can we do to get ready?
Education. Educate yourself. Try to educate the people around you if you feel that you have the bandwidth to do that. Empower yourself. Know your medical history. Know your surgical history. Know your clinical history. Have it in a folder. Have it on your phone. Make sure that you find a specialist or a doctor who actually listens to you, because that's 90% of the game. Okay, you don't need fancy tests. You don't. In fact, there are no tests to diagnose menopause after 45. You shouldn't be having tests. So it's so important that women educate themselves, empower themselves, be their best champion, but at the same time not judge themselves. I do think women are so harsh, myself included. We are always guilty. We are not doing enough for others. We always put ourselves even below the dog, so it's so
even below the dog.
Yes. Well, our dogs, both my dogs are the kings anyway. So, Rajiv and I are right at the bottom. So it's so important that we are kind to. I always say, talk to yourself the way you would talk to your best friend or somebody that you really love. Would you be using those harsh words? If you're not going to say those harsh words about their figure or their eating habits or the way they behave, would you then, why are you saying it to yourself? You're given this one body. The fact that it's moving, walking, doing whatever it is for you, it's amazing. And sometimes it makes a little mistake, so listen to it. Like Rohini has written a lovely sentence. Listen to your body, because, when it don't listen to its whisper, it'll have to shout. And that's when we start falling ill.
Absolutely. And sometimes we don't know what the whisper is trying to tell us. But
you have to listen.
If I'd been more prepared, I would never have eight months of that trauma had I known.
Yes. Education is really the key. It's, knowing your body, know the different parts. You can't go and be vague in the surgery that I have, soreness. They'll treat you for thrush when actually you have a skin condition called lichen sclerosis. So if you don't know the difference between your vulva, your vagina, your cervix, you will not be able to explain that. So if you have the power of in the language and you understand that, then you have to actually be able to communicate that. And I know that I'm asking a lot from women, but the only way a revolution will come is when we as women say enough. We need to be heard. And I say the same for men as well. I think men are also, I know there are a lot of men who are in powerful positions, but a lot of men also don't get heard.
I agree, absolutely. And my husband's a very gentle man.
Yes,
and I have to advocate for him to be heard.
Same with Rajiv. I have to push him.
Let's talk a little bit about veganism. So you are part of a vegan powerhouse family.
Yes.
2 wonderful daughters, your husband Rajiv, who is a
spinal
surgeon, an incredible vegan family. Is veganism suitable for all stages of life?
Oh, 1,000%. There is very little doubt in my head. Yeah, I became vegan because my younger daughter came home. She was about 9 or 10 and said that she was not eating sausages or chicken anymore. So I said, why can't you be vegetarian? And she said, well, Mom, white equals red. And I said, I don't understand. She said, I know you're a vegetarian now. I had tasted chicken a few times and she said, the same cow that has to give the milk has to then go to the slaughterhouse, and it becomes red. So, I don't see much difference. And so I'm not going to be a vegetarian. I'm going vegan. My
White
brother
becomes red. What a lovely phrase about the journey of milk. White becomes red.
Yeah.
Quite.
And so she already had been exposed to veganism. My brother and my sister-in-law were vegans in the early 1990s. My mother was to make her own soy milk in India, which was really from beans.
Pioneers.
My sister's vegan. My nieces are vegan. And then, of course, my Rohini's partner became vegan within a couple of years. Rajiv took the longest, actually. He watched a documentary called Forks Over Knives. And when I came home, he said, I'm going plant-based, I'm going vegan. I said, wow, what did I say after 18 years? He said, no, I watched a documentary. And I said, darn.
Yeah, hello, I've been here all this time. Well, whatever it takes.
Absolutely. In fact, Rohini, her in-laws, within 2 meetings of her, all of them went vegan. Wow. All of them, the whole family.
2 meetings. That's 2 meetings. Advocatism.
Yeah.
Fantastic. In my forthcoming book, We Cook Plants.
Yeah, I'm so excited.
I'm very excited too. It's in collaboration with Made in Hackney, the charity I founded 12 years ago.
Made in Hackney.
Dr. Nitu is a proud ambassador of. We had a fantastic conversation about soya.
Yes.
And again, soya is something that people get in a real muddle about. It gets a terrible press. It gets a terrible beating for, the environment, for health, etc. Please put us straight on that. Tell us about soya.
Okay, first of all, I get paid by nobody for soya, but soy is my favorite bean in the world. It's the most wonderful bean that was probably discovered in China 5,000 years ago. It's a legume. And the beauty about soy is that it has an abundance of protein, more protein than eggs. It has lots of micronutrients and vitamins and minerals, but it also has something very magical called plant estrogens. Plant estrogens are present in blueberries, pistachios, in flaxseed, in all kinds. Isoflavones are what soy contains. And they are very healthy. Why are they so healthy? Because they're plant estrogens that basically displace the mammalian estrogen. So somebody who's having dairy, for example, has the estrogen that's present in breast milk to make a little baby cow of 3 kilos into 300 kilos, while we are then consuming as humans, where we are a 3 kilo baby becoming a 60 kilo human. So you can imagine the havoc that the prostate cancer, ovarian cancer, breast cancer, all links. So when you consume soy, especially as a child, so after the age of 1, because before that you have to have very, either breast milk or, properly with a pediatrician, you got to have whatever plant-based formulas you're going to have. But after the age of 1, we know that studies are suggesting that when you start introducing a handful of soy in a day, then young adults and children, they will reduce their risk of breast cancer and prostate cancer. In fact, those who eat soy, men who eat soy regularly, have a 25% reduction in risk of aggressive prostate cancer compared to a 25% increased risk with cow's milk. So that is so important to know. Soy.
That is a newsflash for many people.
Yes.
Because my sister's had breast cancer and she was told to avoid soya milk.
So people who have soy with a history of breast cancer will have something like a 30% reduction risk of dying from the cancer coming back.
If they drink soya milk.
Yes.
So it's the opposite.
Opposite. Yeah. Even the Cancer Society now acknowledges that soy is a very important, necessary part of a diet in women who have had a history of breast cancer. So lots of studies now. But soy, because of the way it works, it's an anti-angiogenetic factor that it has. That means it prevents new blood vessel formation that is critical in cancer. What it does is it reduces the risk of liver cancer, bowel cancer, ovarian cancer, womb cancer, prostate cancer, breast cancer. That's the power. It reduces the cholesterol levels. It helps you to lose weight. It gives you a slimmer waist. It protects your heart. So it helps to lubricate your vagina. So
wow. Yeah. And yet often people think the opposite.
Yes, because the dairy industry has done a very good job of telling us how dangerous soy is. So if anybody who's listening is having oat milk or almond milk, no. soy milk all the way, okay? Unless you're allergic. 2 or 3 people out of 1,000 may be allergic. Most of them will grow out of it. 2 or 3 in 100 are allergic to dairy. So first of all, nutritional quality best is to have soy. How much of soy should you have? Anywhere between 2 to 4 portions. Why wouldn't you have 6 or 10 portions? Because you don't want to exclude all the other beautiful fruits and vegetables and beans and potatoes and things that you have to eat, spices and nuts and seeds. So you want to have 2 to 4 portions. What is a portion? A child's portion is a child's hand, what they can hold. How much of tofu? For us, it's a handful of tofu, a handful of tempeh, a cup of soy milk, a handful of edamame beans, soy yogurt, miso, natto, any of these you want to have. Environment, really misleading again. 7% of the soy production is consumed by humans. They do not come from the rainforests. They come from Asia, where there's no breaking down of rainforest. Almost all the soy, 61 kilos, is what an average omnivore eats, because 61 kilos of soy is fed to cattle, fish, and all that. And that's where the destruction is coming from. The carbon footprint of soy is not from humans eating soy. I have a free fact sheet on my website. I have chapters both in the Living PCOS book and in the Finding Me in Menopause. I'm very passionate about soy because it can change, especially as we need more protein when we are pregnant, when we are menopausal. You have to lift weights. Strength training is so important. And how do you get that plant protein? Yes, other beans have it to some extent. Nothing has it like tofu and tempeh and edamame beans and soybeans. And a beautiful study, Sarah, that Dr. Neil Barnard did, a randomized control trial where they looked for 12 weeks, so very short trial, 12 weeks of women eating half a cup of mature soybeans in their plant-based diet, 84% reduction in severe hot flushes.
Wow.
That would make headlines if it was a medication. So don't take your soy isoflavones in the form of tablets. Don't spend your money on lots of supplements. What you need is vitamin D, B12, maybe some algae-derived omega-3, but what you need is all your plant estrogens through food. So a tablespoon of flaxseed powder, milled chia seeds, these all contain lignans, same as soy, isoflavones. They'll help to reduce your breast cancer. Green tea helps. Mushrooms help to reduce the risk of breast cancer. So it's so important that you eat a wide variety of colorful foods. When you look down on your plate, colors should be jumping up. Don't be scared of things like baked potatoes with baked beans and hummus and a lovely salad. You want to have foods that are easy, simple, but absolutely delicious and nutritious.
Yes, delicious, nutritious, culturally appropriate.
Yes, it should be a joy to eat. There is no deprivation involved. I am a foodie. I go to sleep thinking about food. I wake up thinking about food. I eat a lot of food.
Me too.
Yes.
Me too. I'm quite what I call stomach-led, stomach-driven.
Yes.
And I will manipulate a route somewhere by up to 25 minutes, saying, the shop with
100%.
vegan pastinato is just around the corner. But it's like a 25-minute detour. My husband's onto that now. He said, how far is this actually? Just before we wrap up, I'm going to do a little quick fire round with you.
Okay.
So I'm going to give you 2 options. You pick one.
Okay.
Try not to think about it.
Okay.
Authenticity or health?
Authenticity.
Donuts or cookies?
Donuts.
Street protest or email protest?
Street protest.
Reading or watching?
Reading.
Train or plane?
Train.
Activism or influencing?
Influencing.
Bike or bus?
Bus.
Oat milk or soya milk?
Soy milk.
Jungle or classical?
Classical.
Early mornings, late nights?
Late nights.
Joy or rage?
Joy.
Joy. Wonderful. Do you have with you some of your recommendations for our Meet the Vegans Pass It On, which is when I asked, and if you haven't, no problem, do you have a book that you would recommend, a book that's changed your life that you would like to recommend?
A book that's changed my life? No.
No book.
But I have many favorite books. One of them is the most recent one I've read about the 40 Rules of Love. It's about Sufism. It's Elif Shafak. Highly recommend her as an author. It's the most beautiful book. Sufism is the spiritual side of Islam. I'm not religious, but I just found that book beautiful. But I wouldn't say that
That's a good
No.
recommendation. That's it. If you found it beautiful,
Yeah, I don't think there's any book that's influenced me a lot.
a documentary you would recommend.
Oh, I could never go vegan.
And why?
It's just Tom's done such a fantastic job in it. And of course, I'm featuring in it.
Featuring yours truly, of course, fantastic. And is there a person and their work who perhaps isn't that well known that you would like to share?
I'd probably say Brenda Davis, who's very well known in the plant-based world. She's an amazing dietitian, and her work is really seminal everywhere that she does. Her books are amazing. Nourish, all her books are fabulous. So I would say she's probably the one. The other person I would say is Rohini, my daughter, who I have to say inspires me every day. Both my daughters inspire me a lot. So the work she's doing in nutrition is just fascinating.
And finally, your favourite vegan recipe, which is your homemade, do you say kichari?
Kichiri.
Kichiri.
Oh, I love my khichdi. It's such a simple comfort food. You can have it in summer, you can have it in winter, you can dress it up, you can not dress it up. It's basically lentils and rice, and it's so, because I'm a very lazy cook. I love cooking, I cook very well, but all my recipes, including khichdi, I think is in your book, in my book, as well as on my website. I have so many free recipes. But it's so nutritious, and I often put a cup of quinoa into it, lots of vegetables. It's easy to make. You can batch cook it.
It's quite cheap to make as well,
and it's so cheap, and it's just so delicious. You're making my mouth water.
And when was the first time you had this dish?
I think probably at home, or probably in a friend's house in Calcutta, because Bengalis love their khichdi. But then I have modified it. I never follow recipes generally. I look at it briefly and then I do my own thing. And that's what I've done. So I love the one that I've done.
Well, we will be sharing that recipe with everyone. So I have my final question of the session, and that is, the world is going through some really turbulent times.
It is.
Right now. What inspires you and gives you hope to keep going?
I think the younger generation, looking at them, I think they are really getting it and realizing that time is limited. And I think also just being hopeful. As I said, I did spend the first few years when I first turned vegan, being angry. It didn't really serve me at all. And so just having that hope in humanity, I do believe that we can achieve a lot of things if we work together. I don't want to think about the alternative, so I won't allow myself to do that. So,
thank you so much for joining me today. I have learned so much, as I always do when I have a conversation with you. Thank you for your work, your enthusiasm, and for all the women's lives you've changed in your career.
Thank you, Sarah. You're a brilliant host, I have to say. Really enjoyed it. Thank you for inviting me.
Such a pleasure.
Thank you.
Wow, what a fantastic conversation with Dr. Nitu Bajekal. So empowering for me to listen to her speak with so much conviction about what we can do to improve our health, and just hearing her speak so passionately about vegan health and nutrition. It's just so affirming to hear that and to know that the choices we're making are actually the best for ourselves and the planet. I'm so grateful for her expertise and her enthusiasm and for everything she shared with me today.